Quick question. How many of you are on TikTok? I see a few hands, but I think the many hands that are not being raised is indicative of why we need to have young people as part of these conversations, or else we're missing out on some really viable and important communication tools. Well, I'm excited to continue the conversation with one of our partners, ISN, on the often neglected kidney disease and how important it is in the whole grand scheme of things of our global health. And so I'd like to welcome to the stage Jenni Cardamone from Devex.
Thank you, Kate, and great to be here with you all in New York and for those of you joining us online around the world. I'm joined today by Dr. Valerie Luyckx, who's the chair of the Advocacy Working Group of ISN, or the International Society of Nephrology, and Kevin Fowler, who's a principal at the Voice of the Patient, for this important discussion of an often overlooked issue. We just heard on the last panel about the importance of elevating voices of people with lived experience, and that is a theme throughout the day. So Kevin, I'd love to start with you. You, 20 years ago, had a kidney transplant, and oftentimes people think, that's it, you're done, you're good now. We talked about this earlier. So I'd love for you to reflect a little bit on how care and management of this has changed over the past 20 years so that we can inform strategies moving forward.
Yeah, first of all, I want to say thanks to Valerie and the rest of the group from ISN for the invitation. I'll just say this from my standpoint, I just want to make a qualification. My experience with kidney disease is much better than the norm. I'm 20 years out, half the kidney transplants fail at 10 years. But one thing I'd just like to point out is that I think kidney disease is fraught with lots of false narratives. And one of the false narratives is that many people think that if you have a kidney transplant, it's a cure. And so I think the biggest thing I would say that what has changed in my experience is that about 10 years ago, I began to look at the policies in the United States that were focused upon early intervention of kidney diseases. And 10 years ago, it was pathetic how little was allocated to that. And so I think that probably the biggest change for me is that that's where my focus has been for the last 10 years, is focused upon early identification of kidney disease high-risk patients, intervention, and then also access to innovation.
Thank you. And Valerie, we know that kidney disease is interlinked with so many other conditions like diabetes and hypertension. So what strategies should international health organizations and governments implement to advance kidney health care within the global health ecosystem, especially in the context of the interplay within other non-communicable diseases?
So thank you very much, and thank you as well for this opportunity to speak here and raise the voice for people living with kidney disease. I think one of the biggest things from international and advocacy organizations is just to raise awareness that there are over 850 million people around the world, about 1 in 10, who are living with some form of kidney disease. And this is then a risk factor for worse outcomes with heart disease. It's often a consequence or a cause of hypertension. It's one of the major consequences of diabetes, etc. So as you said, there's a huge interplay. There's also an interplay we just heard with HIV, with malaria, with tuberculosis. There's interplay with maternal and child health, with nutrition, with gender inequities, with everything we've been hearing about today. So I think from the advocacy perspective, we are trying to raise awareness that kidney disease is something that is very common. It has now reached the 9th leading cause of death, according to the World Health Organization, and the number of deaths has increased by 95% between 2020 and 2021, so enormous amount of deaths. The issue with kidney disease is it hasn't been prioritized amongst the other non-communicable diseases, and unfortunately, as we all know from the Millennium Development Goals and the Sustainable Development Goals, unless something is overtly prioritized, governments are not really obliged to track, or they put all their resources in tracking other things. So I think our message really to the policymakers and the decision makers is that kidney disease is not complicated. You don't need an entire silo to address kidney disease because of its overlap with so many other things. It's also very easily detected with a simple blood test and a urine test. So it's easy to identify people at risk, and managing patients with kidney disease uses the same medications, the same strategies that we use to treat diabetes, hypertension, cardiovascular disease. So if it's treated early and caught early, it can actually be stabilized. And then people don't have to go into the dilemma of dialysis, transplant, or when these treatments are not available, dying. And in low and middle income settings, actually dying young. between 20s and 40s, for example. So I think the message to the policymakers is kidney disease can relatively simply be integrated into existing programs. It doesn't need entire new independent programs. And that simplicity of the message should be conveyed. Because we have the capacity then to save a lot of lives, a lot of quality of lives, and also cost through that. Thank you.
Thank you. And speaking of medicines, I know you brought some with you today and were showing me, and I think it was quite a visual. So talk to us a little bit about how you've managed your CKD.
Yeah, I'm just not doing this gratuitous.
The microphone.
Oh, okay.
You need two hands.
Oh, that's okay. I'm multidimensional. I can do that. I think I brought this as a visual just to show that these are the amount of medications that you take to hang on to your kidney, and these medications come with a lot of side effects. Not just side effects, but health risks. So I've had cancer. I've had plastic surgery of a face. Increase the risk of diabetes, and so there's a lot of these different factors that contribute. A lot of uncertainty in your life. And so I think that the discussion today was a lot about mental health. That's really been absent in the discussion about kidney diseases. And if you think about it for a second, kidney disease is linked with impairment of cognition. In dialysis, it's just appalling what happens. It happens in kidney transplantation, and the evidence now shows it happens in kidney diseases. So for me, where I put my efforts on, and I learned early on, is that figuring out this part is important to hold on to this. And I think that's an area that I find many physicians don't fully appreciate.
It's really important and way to connect in with the mental health piece of a lot of the work we've been doing over the last 2 days. So we all know that this week needs to be about a lot more than just rhetoric, right? We need to see action, and that's something we've talked about on and off stage. So what critical actions, Valerie, do you want to see governments taking after UNGA Week, as we all go back to our day jobs outside of this, to improve patient outcomes, to address societal challenges, and to really integrate kidney care into all of these other sectoral challenges that we're talking about?
So I think what's really critical is pretty much everything we heard about today overlaps with kidney disease. So again, kidney disease needs a multi-sectoral, holistic approach to actually wellness and kidney health rather than just thinking about kidney disease. A lot of that is eradicating poverty, gender equity, ensuring nutrition is critical. Obviously, looking after the patients in kidney disease is very critical to achieving SDG 3.4 because it's also got its overlap with other diseases. So I think what we would really hope is that governments at least open to this to recognize that kidney disease is something important. It is changing outcomes and lives and qualities of lives. It actually exacerbates poverty and is actually taking up a very disproportionate proportion of the budget in countries that are paying for dialysis and transplant compared to the proportion of people who are actually affected. So it's very expensive for economies. So there is also an economic argument. But the biggest thing I think is that the burden of kidney disease needs to be documented. And so countries need to start tracking kidney disease so that we can actually understand how big is the burden, where is it, where are hotspots, are there specific communities like we know in Latin America, there's very big hotspots of chronic kidney disease, so that we can then develop sustainable strategies. And then because kidney disease is so expensive, we need to also develop sustainable, I would use investment rather than financing from one of the speakers this morning about how do we invest in kidney health to try to maintain kidney health so we don't have to continue to pay so much for expensive therapy down the road.
Yeah, and I'd like to pick up on that in knowing that it doesn't have to be hard, right? Do you see any governments that are really doing this well, or any case studies or examples that others can learn from?
There definitely are certain countries that have been champions. And one country, for example, is Thailand. They rolled out universal health coverage in 2002 and did not initially include dialysis and transplantation. They then did very systematic studies, realized people were suffering enormous amounts of catastrophic health expenditure, so included dialysis in their universal health coverage in 2008, but at the same time recognized we have to prevent kidney disease. So they have rolled out very good primary care education. They've enabled primary care practitioners and other clinicians to manage and detect kidney disease early, and they've recently been publishing the outcomes of this, and they're realizing it's highly cost effective. So I think Thailand for me is a country that's really a beacon of hope because it was a low and middle income country when it started. It is now an upper middle income country, but it's really gone about this in such a systematic way that it's really shown that it's worth it. And it's hard to argue then with saving lives and saving money and saving quality of life at the same time.
Absolutely. And Kevin, what would you like to see coming out of this week? Again, being that voice of lived experience, having a near-death experience quite recently, right? I mean, once you had your transplant, that was not the end of the story. It's really the beginning.
And a nice little exposure of food poisoning about back in February. But anyway, I would just say maybe first of all is use the term kidney diseases. It's not this homogeneous disease. There's a lot unknown about kidney diseases. So if I were looking at countries prioritizing screening for high-risk patients, advocating for access to innovation, and then developing a patient voice. Because at the end of the day, a strong patient voice has a lot more urgency than other stakeholders.
Thank you for taking the time to be here and share your experience with us. I know we're out of time. Valerie, any closing remarks from you and calls to action for those policymakers and others in our audience?
I think really just listening today, very many of the speakers actually gave an example, told a story. We're hearing the personal story, and this is the biggest thing we can't forget, is that policymakers also need to remember that this is all about the individual and their families. And I think that's something as well that one really needs to emphasize, because kidney disease definitely takes a village once one gets advanced kidney disease. And so I would say not forget the individual.
Well, thank you. And thanks to ISN for helping us shed a light on this, on CKDs, diseases, as you said. And I wanted to also say thank you to ISN strategic partners, AstraZeneca, Boehringer Ingelheim, Baxter, Bayer, Novartis, and Otsuka, because our work wouldn't be possible without the support of our partners.
And if I can just mention, we have a booth at the back there, and if anyone is interested, we have a petition that people can sign to try to motivate governments to actually act and ask the WHO to act. And then we have a pledge that can be signed as well by any policymakers, decision makers, to pledge that they're also willing to join us in this action to improving kidney health globally. Thank you very much.
Thank you. And we're going to welcome Rumbi to the stage now. Thank you.